Okay, so I'd like to introduce our next speaker. Dr. Dana Paquette has worked in public health and the surveillance of HIV and hepatitis C for over 10 years and has a PhD in health, sexuality, and culture. She is currently the manager of the track surveys at the Public Health Agency of Canada. The track surveys are integrated biobehavioral surveillance systems of populations most affected by HIV and hepatitis C. So please join me in welcoming Dr. Dana Paquette. Sorry about that.
Okay, here we go. All right, so before I launch into it, I just want to start by thanking a whole bunch of people, especially the men who took the time to participate in EMIS 2017, but also the Health Initiative for Men who partnered with us to help promote and recruit men into the survey, and a number of other community-based organizations who did the same. And finally, I also want to thank some Canadian community-involved researchers from across the country who helped us with making a decision about whether we should go ahead and participate in this survey, but also provided advice and feedback on the questionnaire, advice on how best to promote and recruit, and who are now helping to interpret the results. Okay, some background on how we came to participate in the European Men's Internet Survey. So we were approached in 2016. At the time, and still this continues, gay, bisexual, and other men who have sex with men, you all know this, are particularly affected by STIs, especially gonorrhea, syphilis, and also particularly affected by HIV. In 2016, it was estimated that of all the new infections in that year, 53% were among gay, bisexual, and other men who have sex with men. EMIS seemed particularly well suited to help us out in giving us some information to help guide interventions and actions. The aim of the survey is to generate data useful for the planning of HIV and STI prevention and care programs. It was undertaken by Sigma Research in the UK and the Robert Koch Institute in Germany. And they ran the survey in 2010 and again in 2017. And in 2017, they opened it up to non-European countries. We decided to go ahead and support Canada's participation in EMIS 2017 so that we could get that valuable information on risk factors, behavioral and structural factors that are contributing to these increased rates of STIs and HIV. The survey was online from October 2017 to January 2018, and at the end of it, they had about 137,000 participants from over 40 countries. In Canada, after data cleaning, we had 5,473 Canadian participants. And just to give you a sense of who those men were, it's definitely not a representative sample, but 62% were recruited through social and sexual contact apps, and 34% were recruited through community-based organizations. So you can see that these men are active on sexual and social contact apps and also connected through their community-based organizations. To give you a bit more sense of who those participants were who participated in EMIS, the average age was 39, ranging from 16 to 78. 98% self-identified as cis men and 2% as trans men. 75% identified as gay, 18% as bisexual, 2% as straight, and the other 6% as some other term or no term at all. And here's the distribution of EMIS participants across the country. You can see that every province and territory was represented. BC was a bit overrepresented and Quebec was a little underrepresented, but generally provinces and territories were on par with how the population is spread out across the country. Okay, so let's get to the meat of it. So now I'm going to talk about chemsex, engagement in chemsex among the EMIS participants. These are some very early results and just a bit of an exploration of what's in this survey. So I'm looking to you to let me know what's useful to you. Are there particular things that you see in there that are interesting and meaningful and you'd like us to dive further into in a more complex analysis? Or is there a different approach that we should be taking to looking at these data? So I'd love to hear from you at the end of this. Okay, so chemsex in the questionnaire had a very specific definition. So men were provided with this definition here. The use of stimulant substances, and then a list of substances, during sexual intercourse to make sex more intense or last longer. So men were given this definition and then asked if they had engaged in chemsex. 21% said that they had ever engaged in chemsex. 12% said that they had engaged in chemsex in the last 12 months, and 6% within the last month. And what we're going to do for the rest of the presentation is focus in on the men who engaged in chemsex in the last 12 months. So that's 12% of this sample. Just to give you a sense of how that's distributed across the country, that ranged from 5.6% to 14%, depending on the province or territory. And BC, Ontario, and Quebec were above that national average. A bit of context around that engagement in chemsex in the past year. So the stimulants most used were crystal meth, was at the top of the list, and then cocaine, and then GHB or GBL. And 74% said that they had combined stimulant drugs with sex with more than one partner at the same time, not surprisingly. And mostly this happened in people's own homes or in other people's homes. Okay, so now we're going to compare the men who had engaged in chemsex in the past 12 months with all the other men, just to get a better sense of who these men are. So when we did this comparison, these two groups were very similar in age, financial status, and province, and where they lived across the country. But there was a larger proportion of men who had engaged in chemsex in the past year who lived in big cities of over 1 million population. In terms of sexual practices, there was a higher number of non-steady, condomless intercourse partners among men who had engaged in chemsex in the past year. And there was also a larger proportion who reported never using condoms during intercourse with non-steady partners in the past year. We also took a look at knowledge of these two different groups of men. We found that men who had engaged in chemsex in the past year were more knowledgeable on a number of different things, including transmission of STIs, U equals U, and on PrEP, including what PrEP is and how to use it. We looked at access to prevention and healthcare services, and we found that there was of men who engaged in chemsex in the past year, a larger proportion had been tested for HIV or tested for other STIs in the past 6 months. We also found that in terms of PrEP, men who had engaged in chemsex in the past year were more likely to have been told by a healthcare provider about PrEP. They also, a larger proportion also said that they would use PrEP if it was more accessible and less costly. And a larger proportion also said that they had ever taken PrEP, so 17% compared to 7%. Of those who engaged in chemsex in the past year, a quarter, 25%, were HIV positive. And of that 25%, most, 92%, were on treatment and virally suppressed. For drug treatment services, there was a higher proportion who had ever consulted a health professional with concerns about their drug use, and a higher proportion, 17%, who had engaged in some kind of drug treatment program. Okay, so just to sum it all up, the most consumed stimulant during chemsex was crystal meth. We found that there was a larger proportion of men who engaged in chemsex in the past year who were engaging in condomless intercourse with non-steady partners, but better knowledge of PrEP and STI transmission, HIV transmission, higher testing rates. If they were HIV negative, they were more likely to be using PrEP, and if they were positive, the majority were on treatment and virally suppressed. They also had this higher use of drug treatment programs. But this analysis also shows some big gaps, still work to be done. We found that 47% of men who engaged in chemsex in the past year said that they were very likely to use PrEP if it was available and affordable, but only 17% had ever used it. And while this group was more likely to have access drug treatment programs, still there was between 73 and 83% who had not accessed those services. Okay, so before I finish up, I just want to also thank the group in Europe who put on this survey. It was a huge undertaking, I can't imagine, especially Axel Schmidt, who was our contact and a big champion of Canadian participation. And that's everything. Does anybody have any questions or feedback?
Hi, I have a question. So I guess EMIS is really exciting because it's so many different countries and there's hundreds of thousands, or I guess 100,000 respondents. I'm just curious to know, how does Canada measure up with the other countries, or what kind of analyses do you have planned to actually utilize this huge data set and really get to kind of compare between places?
Yeah, so the group who is running the survey out of Europe, the Sigma Research and the Robert Koch Institute, are planning a big international report. The text of it will only be the EU countries, because that's what the funding they received was for. But the annex to that report will have all the countries who participated. So we'll be able to look at that annex. It'll be publicly available. So we'll be able to look at that annex and see where we are located in terms of all of those different countries.
Will we have access to the global data set as well as participating in the research?
We don't at the moment. But if we wanted to have access, if someone wanted to have access, it would involve applying for that access. It's possible.
Yeah, it'd just be cool to see beyond just the annex, to kind of just maybe do our own analyses, or have Canadian researchers actually able to do those kind of comparisons on a global scale. I think that'd be a really unique opportunity. So yeah.
Yeah.
Thank you. That was really, is this working? Yeah, sort of is. That was super interesting, and I'm sort of feeling surprised at what I'm walking away from the presentation with, which was it sort of seemed like the guys who are engaging in chemsex on most of the indicators are doing better. They're actually doing pretty well. So that's not definitely like a reflection of the entirety of their lives, but this sounds like a good news story a little bit. It sounds like they're doing what they need to do to be informed and access services, and better than guys who don't engage in chemsex. I'm just curious about that. Yeah, your thoughts about that.
Yeah, I think it's interesting too. I didn't have any preconceptions of or expectations going into it, but I think it is a good news story and not a bad news, but it does point to the limitations. Even though these men seem to be more knowledgeable and be accessing services at a higher rate, you still see quite a few gaps there, especially around access to drug treatment services. So I think it's good news and a few challenges that we still have to take up. And just to let you know, Dane was telling me just before the presentation that they looked at the EMIS data around chemsex, and also in combination with some Ontario data around chemsex, and the data were quite similar. So that helps give it some weight, because we know this sample is not representative. So it's good to be able to triangulate with other data sources.
Thank you.
Hi, Dana. Mark Gilbert. Just a quick question. In the survey, were there any questions that would give some indication around like problematic substance use? Because I mean, the assumption around that everyone who's having chemsex needs drug treatment implies that everyone has a problematic use of drugs with that chemsex. I'm just wondering if there's any way of distinguishing between that.
So I think I got your question around, it's around problematic drug use,
Yeah.
whether the drug use was problematic. I'm trying to think about whether, because I know there was a question around a scale for problematic alcohol use, but I don't know if there was one for drug use or not.
Okay.
I'm not sure. I'd have to go back and check.
Okay.
I can let you know.
Thanks.
Hey, Dana. Thanks for that talk. Just a quick question. If you looked at any associations with Chemsex and any of the STBBIs, so particularly in looking at LGV with higher rates with Chemsex or looking at the syphilis rates. So I don't know if that was included in any of the conversations or questionnaires or any comparisons were made.
Whether there was higher rates of other STIs beyond HIV?
Yes, yeah.
Yeah, we could look at that. We didn't look at it for here, but that would be interesting. So we did find that there was a higher number of men who were HIV positive among those, but we didn't look at
the other STIs. You guys didn't look at.
And because it's cross-sectional, we wouldn't be able to. It'd be hard to know, you know, what came first. What was the
right?
But we could take a look at that. Right. Thanks.
Okay. Yeah. Thanks.
Sorry, I just wanted to jump in on that. If you do look at that analysis, I just caution that we be careful. If there's higher rates of testing for STIs, you might find higher rates of STIs, but that does mean higher prevalence, right?
Right. Good point. Thanks. Okay. Thank you.